What about things that we worry about with regard to female health? Patients that, say, smoke, who are now in their 60s, perhaps early 70s. What about dietary influences? There's a whole bunch of things that come to mind.
Yeah, great. So the way I educate my patients is by telling that to look at what that activity, such as smoking, might do to the health of the tissues at the level of the pelvic floor.
Mm-hmm.
So if the smoking, for example, would compromise the blood supply, and the compromise in blood supply would translate into weaker muscles, weaker connective tissues, then they would be more likely to experience prolapse.
Mm-hmm. Which is a biggie.
Right. Obviously, diet, it's very easy not to intake adequate amount of protein, and that might have an impact on the health of the connective tissues and the musculature of the pelvic floor. And on the other hand, exercising, highly important.
Very important.
Very important. The more you exercise, the more you can maintain the muscle tone of all these muscular structures in the pelvic floor that are supporting these organs in place. And that's where physical therapy comes into play, essentially to rehab these muscles so they undergo hypertrophy or growth, their tone would increase, and as a result, they can maintain these tissues in locations where they belong.
Yes.
As opposed to out of the so-called the comfort zone.